When you look at what laser to start with, I think if you're in a dermatology practice, a V-beam becomes a very useful tool both for the vascular part and the fine wrinkle part. And they've added another feature to the newest V-beam Perfecta where you can treat pigmented lesions also. So for a dermatology practice, I still think it's one of the best starting lasers.
What's remarkable actually about the Candela Perfecta is how reliable it is, because it's very seamless to use, but I know that there's a lot of technology that went into making it such an easy device to use.
What that means, the dye part, which is DYE, is actually a fluorescent rhodamine dye that is used to generate the laser light. The pulsing part of that name is that they found a way to actually pulse the laser as it comes out of the device rather than be what we call a continuous wave. So that's the final rendition of that name is pulse dye. And this was originally designed specifically to treat red birthmarks. And so it has always been thought of as the dermatologist's laser for treating vascular disorders. The V-beam laser has been thought of as a vascular laser, but in my practice I probably use it more for other things, more cosmetic things. I find it to be one of the most useful of what I call non-ablative resurfacing, where I treat fine wrinkles on the face. It's a painless procedure. It takes 5 minutes to do, and patients love this. It really helps find wrinkles. And the other thing that it probably does that I just think is the most remarkable is if you get a patient who bruises, either from, say, a dental procedure or a filler procedure or a surgical procedure, if you bring them back the next day and treat them with pulse dye, it will disappear, the bruise will disappear overnight.
I think in our practice, V-beam is something that fits into that mold very well. We have 4 doctors in our office, and we see a lot of patients who have rosacea, and that machine is being used constantly for rosacea patients, erythematotelangiectatic rosacea patients. And then for the folks out there from an aesthetic perspective, treating the poikiloderma of Savant that they have on their neck, V-beam has worked very well for our practice as well. We see people who may have port wine stains, we see people who have big vessels on the side of their nose, or we see people with venous lake. And V-beam has been really a high-functioning piece of equipment in our office and very effective for those conditions.
The V-beam Perfecta is an extremely, extremely safe laser. Safety profile, you know, we treat babies with it to treat port wine stain birthmarks. That kind of tells you how safe it is. Laser has been around since I started practice. And why is the laser still here? Because the technology is necessary and outstanding. And so it's been improved upon, but that laser has totally withstood the test of time. It's a bedrock of my practice. V-beam was my first purchase when I started my practice. I think every dermatologist should start with a laser and should pursue their passion.